Welcome to 5Main Non-Invasive Cardiology at Hackensack University Medical Center. My name is Sarah Huvane, and I'm going to be presenting tilt table testing. Tilt table testing is a procedure done to rule out the causes of a syncopal episode. Syncope meaning loss of consciousness. There are several factors that might cause syncope. Some might be cardiovascular, such as heart block or sinus bradycardia or a slow heart rhythm. Some might be neurological, such as stroke or seizure. And others might be vasomotor, which is what tilt table testing rules out. One cause that's vasomotor is called orthostatic hypotension. That's when a patient is sitting or lying down for an extended period of time and then gets up quickly and their blood pressure drops. Another type of vasomotor cause is called vasovagal, and we see it in about 80% of the cases. Vasovagal is when the vagus nerve is stimulated, either by defecation, urination, pain, a hot shower, or a warm, crowded room. When the vagus nerve is stimulated, the blood vessels are all dilated, opened up, and the blood pools down to the legs, causing a drop in blood pressure. What do we have to do before we do a tilt table test? Well, first, the patient has to be NPO or nothing by mouth for 6 hours before the procedure. Just in case they get nauseous, we don't want any vomiting. The next thing is the patient needs to bring in a prescription from their doctor that clears them for this test. Another thing that we have to do is get informed consent. We want to make sure that the patient is knowledgeable about what happens pre-procedure, during the procedure, and post-procedure, because it's all about patient education. The next form that we fill out is called a timeout form, and it's a 3-step process that we use here to make sure that everybody is on board, same time, same procedure, right patient. We also use this flow sheet during the procedure of the tilt table, and it will monitor their blood pressure, pulse, oxygen saturations, and any signs and symptoms they might be feeling. We have the patient come in, and we have them, they have their clothes on from the waist down with their feet flat against the platform. They can keep their undergarments on top, but we give them a half gown or a Johnny coat so that we can attach them to our monitor. Again, we're going to be monitoring their heart rate and rhythm, their respirations, their blood pressure, and we're also going to be monitoring their oxygen saturation via pulse oximetry. We start an IV in their arm, as we might need this 0.9 normal saline later for blood pressure and or to give medications. Another thing that we have on hand is an old-fashioned blood pressure, just in case that the monitor is cycling and we need to get a really fast or stat blood pressure. We have an IV pump here in case we need to give IV meds later on as well. Once we are ready for the procedure to begin, we get our consent, we do our last step of the timeout process, and the EPS doctor is at the bedside. EPS meaning electrophysiology, who specializes in the conduction of the heart. The RN and the doctor stays with the patient during the whole procedure. We get a set of baseline vitals with the patient lying on the tilt table for about 5 minutes. So the patient's lying here for 5 minutes, then we get another, we get our blood pressure, pulse, respirations, and our O2 sat. Then after the 5 minutes, we are going to bring our patient up. To about 70 degrees. Some places might use anywhere between 60 to 80. Hackensack likes to go to 70. And then we just monitor our patient. Every 5 minutes, we are watching their blood pressure, their pulse, their heart rate and rhythm, and their respirations, and their O2 sat. And we're asking them for signs and symptoms. How do you feel right now? Good. If we are going to see a syncopal episode occur, we normally see a trend of the blood pressure going down, and the heart will try to compensate by increasing the heart rate. A syncopal episode can occur anytime, in the beginning such as now, anytime during, towards the end, or sometimes not at all. If a syncopal episode occurs, either the patient is starting to go out, and some doctors like them to go out completely, and then we will put them in the home position. There's also a button for an emergency situations where they are put in reverse Trendelenburg. But we normally put them in the home position, and with a minute, the blood recirculates and the patient comes out. But suppose the patient does not have a syncopal episode. After 30 minutes, the doctor decides, according to the patient's age, comorbidities, and medications that they're on, he'll decide whether to give medication. Some doctors like to use what's called Isoprel. Isoprel is mixed 1 milligram in 5 mLs, and it's mixed in 0.9 normal saline 250 ml bag, and we have it with special tubing to go through a pump, and we give it to the patient as per the doctor's orders. We titrate it. And what Isoprel does is that it lowers the vascular resistance in the legs, and it's a negative inotrope, which means it decreases the blood pressure, but a positive chronotrope, which means it increases the heart rate. So it mimics that whole syncopal scenario. So since it lowers the vascular resistance, it causes that pooling of the blood again, and we see if it triggers a syncopal episode. Another medications that some doctors like to use is nitroglycerin sublingual, 0.4 milligrams per tablet that is placed under the tongue, and again it causes that dilation and that decrease in blood pressure to see if that we can stimulate a syncopal episode. If after 40 minutes there is still no syncopal episode, the doctor might take his or her stethoscope and listen to the carotid arteries for a bruit or obstruction. If he finds there's no bruit or obstruction, he might do what's called a carotid massage. A carotid massage also stimulates the vagus nerve, and we're looking for that dilation of the blood vessels again to see if it produces a syncopal episode. If there is a syncopal episode anytime during the procedure's over, and it's considered a positive test. If the 40 minutes has gone by and there's no syncopal episode, it's considered a negative test. The patient is then kept and monitored until they're stable to go home, usually anywhere from a half hour to an hour, and we make sure that they go home with a designated driver. Treatment is depending on the findings of the procedure. Well, thanks for joining me here at 5 Main, and remember to always keep learning. Bye for now.